My name is Rosie Bartell, and I'm here today to share some of my personal experiences and how that may be involved in this project of ACTS, learning health systems, digital learning health systems. First of all, my story began 12 years ago when I had what I was considering a routine knee replacement that turned out to develop a MRSA staph infection. That MRSA staph infection led to 58 surgeries, over 200 hospitalizations, more than 100 blood transfusions, 12 septic shock situations, and 3 different amputations. First, 6 inches above my knee, then my hip, and most of my pelvis. Even today, I still deal with pain in my pelvic bone because there is still MRSA in that bone. Within the first year of this happening to me, my infectious disease doctor came to me and said, "We are having a real problem with MRSA in this hospital, and we're going to be doing a study on it, and I think you need to be part of it." And so basically, I spent a week with the leadership and many of the people who worked in surgery, and we looked at all the different reasons why they might be having, and the evidence basically why they were having problems with MRSA. On the final day of that, I then presented the findings that we discovered might be the reasons why we were having this many infections. This led to complete changes in that hospital. So the evidence-guided change improved the quality. That set me on a road to saying, I don't want a world with MRSA. I wanted the world without healthcare-acquired infections. And so I started doing lots of presentations to prevent infections. I also do this for sepsis. I also do it for lots of other things. Yesterday, I spent the day doing it for pain management because early on, I realized that if I was going to use all the opioids that was provided to me because I was dealing with a lot of pain. Many times I did use opioids when I was having surgeries and things, but I realized that I needed to find other ways to deal with pain. I sought out ways of doing that from physicians, from physical therapists, from pharmacists, from a whole gamut of people. I collected ways, basically my own personal evidence of how I was going to deal with my personal pain. That led me to help deal with a pain that I deal with every day, and that is phantom pains. And if anybody knows anything about phantom pains, all the opioids in the world won't help phantom pains. Basically, the evidence that I collected way back 11 years ago are helping me yet today. The great thing about this project is that it's going to be digital. It's going to be both people working together, both sides, healthcare providers and patients, bringing their thoughts, their stories. That's what happened yesterday. We shared the whole day. Our voices were equal in the room. Lots of evidence was shared, lots of information was shared, lots of plans of action were decided on. I also work with some of the electronic record keeping institutions. I also believe that patient portals need to have evidence and education and outcomes connected right to their portals. So if I have this infection, what is the evidence? What is that information? So that my personal information is there, but also the evidence that how to fix this. I used to say, let's think outside the box. I now say, let's blow up the boxes. And so I believe that this project that is happening with ACTS, learning health systems, and this digital way of looking at it, and tools and apps that might help patients and providers equally at the same time, side by side, will definitely blow up boxes. And that's my my end results. I want the world to change, and I think we all can do it together. Thank you, and have a good day.